Blood types may play a role in which pandemic-infected patients get the most ill. A genetic analysis of patients suggests that their blood type might influence whether they develop the severe disease. Scientists who compared the genes of thousands of patients in Europe found that those who had type A blood were more likely to have severe disease, while those with type O were less likely. This report in the New England Journal of Medicine doesn't prove a blood type connection, but it does confirm a previous report from China of such a link. Most of the scientists and medical professionals discounted this test and study because it was a very crude study. It was also stated that with the new work, they now believe that this study and evidence is very important. Other scientists and medical professionals have urged caution. They have stated, however, that the evidence of a role for blood type is tentative. It isn't enough for a signal to be sure. A study which involved scientists in Italy, Spain, Denmark, Germany, and other countries compared about 2,000 patients with the severe infection to several thousand other people who were healthy or who had only mild or no symptoms. Researchers tied variations in 6 genes to the likelihood of severe disease, including some that would have a role in how vulnerable people are to the infection. They also tied blood groups to possible risks. Most genetic studies like this are much larger, so it would be important to see if other scientists can look at other groups of patients to see if they find similar links or similar results. Many researchers have been hunting for clues as to why some people infected with the infection get very ill and others less so. Being older or being male seems to increase the risks, and scientists have been looking at genes as another possible host factor that influences disease severity. There are 4 main blood types, A, B, AB, and O, and is determined by proteins on the surface of your red blood cells. People with type O are better able to recognize certain proteins as foreign, and that may extend to proteins on infectious surfaces. During the previous outbreak, which was caused by a genetic cousin of this infection, which caused the current pandemic, it was noted that people with O blood type were less likely to get severe disease. Blood type also has been tied to susceptibility to some other infectious diseases, including cholera, recurrent urinary tract infections from E. coli, and a bug called H. pylori that can cause ulcers and stomach cancer. The study has been described as provocative, and many have said that while it is worth publishing and getting the information out there, it needs more verification and more study across a wider range and variety of patients. A team of European scientists say that they have found 2 genetic variations that may show who is more likely to get very sick from the current infection. This serves as a possible explanation for the reason for some people getting seriously ill with the infection while others barely show symptoms. They found that people with type A blood have a higher risk of getting the infection and developing severe symptoms, while people with type O have a lower risk. They say that their genetic data confirm that the blood group O is associated with a risk of acquiring the infection that was lower than that in non-O blood groups, whereas blood group A was associated with a higher risk than non-A blood groups. Researchers also stated that they found that people with type A blood had a 45% higher risk of becoming infected than people with other blood types, and people with type O blood were just 65% as less likely to become infected as people with other blood types. The large international team first published their findings in a non-peer-reviewed preprint server. The report has now been reviewed and published in the widely respected journal. Study was done on 1,900 severely ill patients in Spain and Italy, and they were compared to 2,300 people who were not sick. They did what's known as a genome-wide association study, trawling through the entire genetic map to find 2 DNA variations that were more common in the patients that were very sick. They detected a novel susceptibility locus at a chromosome 3p21.31 gene cluster and confirmed the potential involvement of the ABO blood group system in the infection. And 2 places in the genome were linked with the risk of developing respiratory failure. The researchers cannot say if blood type is a direct cause of the differences in susceptibility. It might be that the genetic changes that affect someone's risk also just happen to be linked with blood type. The 2 genetic variations they found could be associated with a person's immune response, a so-called cytokine storm, an overwhelming overreaction of the immune system. This can be blamed for the most dangerous effect of the infection in many patients. Many professionals also stated that the blood type link is plausible. The genes that control blood type also affect structures called sugars on the surfaces of cells, which in turn could affect the ability of the infection to infect those cells. Plus, blood type is linked with the risk of developing blood clots, and it's now clear that severe infections are marked by unusual blood clotting throughout the body. They have also mentioned that the findings mean very little for the average person. Whilst the increased risk may sound large, over a whole population of people, it's not much at all. The absolute difference in risk is very small. The risk reduction may be statistically significant, but it's a small change in actual risk. You never would tell somebody who has type O that they were at a smaller risk of infection. What the findings are more useful for would be in designing drugs or vaccines against the current infections, as stated by researchers worldwide. There has been a review of blood types and their relationship to the current health crisis that's affecting the world. Like, comment, share, and subscribe. We hope the scientists continue to make new discoveries and to find new information to help treat persons who have been affected by this pandemic. Like, comment, share, and subscribe. Thanks for watching.